Welcome to the Deep Six podcast, where we make a generational impact on you and yours. What we do here is explore a 6-point model into your health, your life, and your journey while you're here. So let's dive deep and help you thrive, not just survive. Hello, this is Dr. Lorenz with the Deep Six podcast. Welcome back, where we make a generational impact in you and yours. We explore this 6-point model, and I have an awesome guest I'm really excited about because I work with him daily, and he's in the practice with us in our functional medical practice where we, do the deep dive, the Deep Six, and we restore your health. And Dr. Ryan Abboud here is awesome. So I'm so excited to have him here, and we got a lot to share, right?
Yeah, thanks for having me. It should be fun.
It's going to be fun. It's always fun.
The Deep Six. I like the name.
You like that name, don't you? Yeah. Well, you practice it every day.
That's why I like
whether
it.
you know it or not. So let me introduce Dr. Ryan, and we usually at the practice go by Dr. Ryan because Dr. Abboud formerly is really stuffy, and so we don't want.
We're pretty relaxed there.
Yeah, we are pretty relaxed. We mean business, but we're pretty relaxed. I think we have a good culture in the office with our patients and everything. So, but let me just tell them a little bit about your background, and so. And we'll kind of get into it because there's so much to talk about. We were talking about before the podcast. There's just so much to dig into. But Dr. Ryan is a doctor of osteopathy, which is osteopathic medicine. He did his board certification in family medicine and specialized in prevention. He practices evidence-based and holistic approaches in functional and integrative medicine with us now at Longevity Health Institute in Southeastern Michigan. He did his training at Michigan State University Medical School, and he has a certificate of population health through the University of Michigan. He is passionate about using food as medicine to optimize cardiovascular and metabolic function, and he loves meditation and sauna. Absolutely. And I can attest that he loves sauna because he wants to bring this semi-truck sauna to my house. Right?
Absolutely.
That he made, him and his father made, which is so impressive, so awesome. And you want to bring it over.
I will, absolutely.
Into the practice. I mean, we've been out to dinner and you're like, I should have had the sauna and we could have just gone into it in the parking lot.
It could be practical, but it's definitely functional.
Strange a little bit, but
it's good. It's good. Everyone should be sauning.
We should be. Actually, a lot of preventative stuff, which we can get into. A lot of preventative stuff, and I'm sure we'll have an entire podcast on this, on the benefits of saunas. Absolutely. Well, thank you for joining us, and you are honestly such a pleasure to have in the practice. I can't tell you enough how much our patients love it, love you, love your results, love your input, love your different approach, and they, all our other practitioners you jibe with really well, and it's been such a great uniting with you in the practice that hopefully it's been as enjoyable for you as us.
Honestly, I feel blessed to be here.
Oh.
It's you really are a good mentor. You do have a good culture. That's one thing I noticed immediately. Even before I started working, when I just came to check it out, I was like, everyone seems to be getting along. I saw the thing on the wall, the kind of our motto.
Yeah, and our core values.
Our core values. And man, it's ringing true. So yeah, I like it. I'm going to stay. I'm here. You're
here, yeah. Well, and this is good because I do pay you. So this is good. I'm glad you said all those things. No, but the reality is I do, because I always feel like our core value and our core focus is so critical, and having a culture like we do with our employees, all of them, all 27 of them, and all our practitioners, it creates that culture with our patients, and they feel it. I have patients tell us that all the time. They feel the love, they feel the energy, they feel the positivity, and I actually believe it helps results. I really do.
Well, yeah, I think it's like a healthy practice. You know what I mean? Mm-hmm. Obviously, just like the human body, it's a system that can become dysfunctional. If things are in balance, the system works. Yeah. And so I think we got it. Yeah, I'm really pleased. I'm really excited. I love talking to the people. Yeah, it's a good practice.
Good. Yeah, good. I love it. So I always do this. When I do these podcasts, I always start with a quote, and I like it because just to kind of dig something out of you. And these are quotes I always love, and I'm big into. I actually read a quote every morning that I get this this fed thing to me, and I love this one. And so I just, it kind of resonated to, I think, ask you this, but tell me what this means to you and kind of, what you think it brings to the table. Success is getting what you want. Happiness is liking what you get. And that's by H. Jackson Brown Jr.
Yeah. This implies you're getting something you can't, maybe outside of your control, not necessarily your choice. But what you want, is a subjective, changeable attribute. So, and happiness, is again something that we can sort of put ourselves in a place to feel happy, irregardless of the situation. And I think for health, it seems that the healthiest patients, the one with the longest, health span, if you will, it's their happiness. It's their happiness, and how we define success is also up to us. So we can define success as happiness.
Yeah,
and then we're both successful and happy.
Right. Absolutely.
It's kind of a circular argument,
For
but I
sure.
think there's something there. I think.
No, for sure. Yeah, for sure. When I read this quote, it reminded me of something I read in a book. The book's called The Psychology of Money, and the author slips my name, but it slips in my mind. Excuse me, but The Psychology of Money, great book, by the way. If you want to go out in there and get it, I'm making my kids read it now, and they're adults, because it's got really, really, rubber hits the road impact into how we think about money and economy. But one of the things that I loved, and this is what reminded me of, is how happiness, and this was a study out of U of M, a U of M PhD, did a big study, University of Michigan, how happiness was really, it wasn't money and it wasn't success when they did this study, and they interviewed thousands of people, which were all, by the way, in their later years. I think they had to be over 60, 65, was that they was a time issue, that they controlled their time. So happiness is liking what you get, but it was like they were in control of time, so they could do what they want, when they wanted, with who they wanted, for how long they wanted. And that like made them feel whole and successful and everything, not their bank account.
Right.
And I love that, because it's like, I'm sure many of these people bank accounts were fine, but it was like, that's really what resonated with them and made them truly happy.
Yeah. Sort of that time set them free. They had.
Yeah. Yeah. And I love it too, because to me, I believe, and it's part of our 6-point model, is that stress life balance and the mind body connection. And
that's arguably the most important of the 6 pillars.
I think it is. Well, we're also only as good as our weakest link, but yes, that often is the weakest link.
Yeah. I like that you picked 6 because it's kind of, that 3-legged stool analogy. You need all 3 legs, otherwise the thing topples.
Right.
It's like we're like a
which, by the way, I heard
3-legged stools.
By the way, I heard in the office you had to stumble off a stool.
Oh yeah, well, that was a wheelie stool.
Yeah.
We gotta get some new bolts. So we got rid of it.
By the way, Nina at the office, who's amazing, she fixed this for us. By the way, she told me she was laughing though. She said, "Yeah, it was a little bit
the right hardware."
But it's good if the patients get to laugh at us a bit.
Yeah,
falling
I
on the
literally
floor.
it was a chair just not too.
Just don't follow workman's comp on me, please.
No, not yet.
So anyway, well, let's dig into this a bit. Could you share with us, something that you felt in, practice in general, here at Longevity Health Institute, that has been an innovation, in practice that we've used, and you've seen how it really influenced, or the approach with your patient care, something that we do in some part of our 6 months, that really resonates with you, and you see like, wow, this really, really helps people.
For sure. Yeah. I think the biggest change from the way I was practicing previously was maybe the focus on gut health. Obviously, gut health is important. I knew it was important intrinsically. Obviously, this is a big exposure to the environment, is what's in our GI tract. We're essentially a hollow tube. But I didn't really have a system to really look, and a systematic way to identify who has gut issues. Obviously, they're symptomatically, but some people seem to have gut issues, this leaky gut.
Yeah.
With not much symptoms, maybe just inflammation.
Right.
So,
and let me, not to interrupt you, I want to hear this. It's so important. But just for our audience, like what leaky gut is. So leaky gut is kind of a lay term we use. It's really like, a dysfunction in the lining, if you will, of your epithelium in your gut. So the intestine and why hold a hole, the tube, like you said.
Intestinal permeability.
Yeah. So this intestinal permeability issue happens because the epithelium break apart, the peptide bonds break apart, and then anything in our gut, our bacteria, our microbiome, our probiotics, our good things, our yeast, which we see on live blood when we do, antigens from food, endotoxemias that come from flora and stuff. Anyway, long story short, what I was trying to get is what leaky gut is for the audience is it's a dysfunction in the lining, yet maybe there's not a disease presented.
It's not a disease, frankly.
It's a functionality.
It's super common. I didn't realize how common it was. And I even had some leaky gut.
Yeah.
Because it's as simple as the way you're eating.
I think aging creates leaky gut. It's part of, we look in the mirror, we see our skin age.
Yeah.
And we see, we know we're aging and our bone and our hair loss and our this and our that. We don't think of the insides aging, but your epithelium age. And I think one of the biggest things is stress, which we know that depletes the mucin lining and damages the gut. So anyway, I want 100%. You to get back to this, but leaky gut is so prominent and so prevalent, but you don't, like you said, don't have to have a symptom.
Well, okay. So I have an example. I had a woman today.
Mm-hmm.
She's actually my new eldest patient. Guess how old she is?
She beat Pearl, mine, 102.
No, she's not that old. She's 95.
Pearl's amazing, by the way.
This woman was amazing as well.
Okay.
I have never met Pearl.
Yeah.
I would love to though. That's amazing. 102.
You got to take them out to lunch.
Let's do it.
Yeah.
But so this woman came in, 95. She lives on her own. She's super sharp.
Love it.
She couldn't hear very well. But otherwise she seemed, completely there, completely with it. She came in with one question, one complaint. She was looking for functional medicine. She said, I have candida. I said, okay, you have candida? She said, yeah, my podiatrist or another doctor said she must have had some kind of foot fungus or something. Mm-hmm. Prompted her to look more in candida. And so, through this process, she had been doing everything she could. And mind you, this is a small woman. Mm-hmm. She's maybe 4'10". Mm-hmm.
Cute as hell, I bet.
Super cute.
Yeah, love it.
89 pounds, tiny.
Mm-hmm.
And I said, okay, so let's talk about it. We did some of the testing we do. We looked to see if she had any signs of leaky gut, and it was actually pretty good. There was hardly any signs of candida overgrowth or anything.
Solid diet, I bet.
So she has a solid diet.
Very good. Diet's so important.
She avoids the right things. Right, she knows what to eat. She's done research. She's smart. But she had been avoiding.
God bless her, by the way. That's awesome.
God bless her, absolutely. So because she had done so much research, she knew that sugar feeds, yeast. Mm-hmm. Candida is a yeast, common yeast. Also yeast are part of our normal flora. Mm-hmm. First of all, we all have yeast,
but shouldn't be in your blood.
Shouldn't be in your blood, and it shouldn't be overgrowth. Mm-hmm. When these things come out of balance, that's when disease may occur. But so she was really surprised, one, that she didn't have this large yeast burden, and two, she had been avoiding sugar, which is a good thing. Mm-hmm. I mean, we give sugar to yeast to make alcohol, right? Right. That's how it's fermented. Well, this can happen in the gut, and yeast can create other toxins, and that seems to be why it's irritating to the gut and that. But she was avoiding fruits, okay? She was avoiding sugars too, but she was also avoiding fruits. And so I explained to her that she could probably have some fruits. And wow, she was ecstatic. And so there's some kind of misinformation, or a lack of resolution on what to do, or she knew that eating sugar was maybe bad, but she didn't realize that fruits may be okay. Mm-hmm. And so something simple like that, diving in to show a person had she had leaky gut, maybe something different, maybe a different approach, but I think that was really like enlightening for her. Mm-hmm. And I was also sort of worried about her. I'm happy now that she can get those calories in because she's so small. She was restricting her diet. Right. Someone who's 95, I mean, you kind of have to let the reins down and let them
live a bit. Right.
Live a bit.
Right. Yeah.
Right.
Live a bit. And she's obviously very proactive, obviously very bright and knowledgeable, and just to have the energy to look into the preventative things and what to eat, what not to eat, what have you. And
seeing so much, she's also lived through she had some crazy stories.
Wow. I'm sure. Well, when you been here that long, that's what happens. But you said something that is like, a couple new patients today, one came in from out of state, and it was like, we pretty much, when I say this, because one of them was a little bit excited about this, we pretty much all have, to some degree, I'm being obviously exaggerating, but leaky gut. I mean, because it's so common, and it doesn't
waxes and wanes.
Exactly. And it doesn't have to be a disease, for instance. But one of the things that I was trying to explain to this patient is that you want to keep your intestinal epithelium, your lining, I call it like the border wall. You want to keep that as good as integrity as you can. And diet plays a role, but you have to actually fix the gut lining, where she was just this person had been so focused on diet, like your 95-year-old, elimination, but not fixing, not using tools to fix the epithelium and heal the lining.
Right.
Like fortify the border wall, if you will. But
Gotta fix it and prevent it.
Exactly. Yeah. But that's awesome. Yeah. I'm sure you'll be helping her. Well, you already did. You gave her some things she could eat, and she was ecstatic. Love it.
And she's had other exposures too, like when she was a teen, she said she had acne, super common. At that time, she went to the best doctor in the land.
Yeah.
And they used radiation on her face, which was apparently, this is before they realized that the harms of radiation.
Wow. So, I've not heard of this.
I hadn't heard of it either.
Other than maybe a textbook in the 30s.
Sure. But apparently, and she developed skin cancer. So, I mean, so she's a fighter. She's been through a lot. She's super resilient.
Yeah.
And that's kind of shows the power of the human spirit, the human condition. I mean, we're resilient beings.
Well, here's, forgive me, what was her name?
I can't remember her name, honestly.
Okay, that's okay. But 95, right?
Yeah.
And then Pearl 102.
Yeah.
And I can tell, I haven't met her.
Yeah, I just met her today. It was her first visit.
But the energy, the mind-body balance, the positivity, what's between the ears, has got her this far.
Absolutely.
I mean, and that's what you were saying earlier, how it's so important in that balance. And I see that all the time. And
she also exercises every day.
Yeah. Oh, yeah.
With her in her apartment, they have classes. She's exercising every day. She's doing things. She's involved in her little community.
Yeah.
It's impressive.
Yeah. And you can stay.
It's inspiring.
It's very inspiring. I mean, so I know this. I did this video with my mom, a YouTube video with my mom, and I'm going to get her in here. It's going to be fun. I'm going to get her in here and make her do it, Or I cut her off. I'm like, you can't come in and get any more hormones or IVs or anything.
Today's my mom's birthday.
Oh, well,
yeah.
Happy birthday.
Happy birthday, Mom.
Yeah.
Love you out there.
Yeah, I love it.
I'm going to go see her later tonight.
Good, son. You need to do that. What are you doing here? Come on.
It's okay. We'll be together.
Give her some love for sure. Absolutely. So, but is my mom, I made her do it because I knew at 82, it would inspire the hell out of people like out there. And I've had patients come to us, and one of our other practitioners said, man, I saw your Doc's mom's video, and that was like, I can do more. And like, cause she lost, 60 pounds, started working out and swimming more. She just joined a weight, lifting class at 82. My mom does planks.
So important.
I told her, take it easy. Let's slow down a bit, but
Yeah, let her plank. That's important. Weight bearing exercise.
Oh yeah. She's so proud of herself too. It's just amazing. It's cute as hell. So thanks a lot. I love that about, you think the biggest part of the, deep six of our model, the 6-point model, or that you appreciated, is the gut health. Is there anything else in gut health that you can think of in what we do, or innovation or therapy, or, large or small, like that you've really seen, wow, that really has made a big difference?
Well, the gut, and I mentioned the yeast, but bacteria too can produce toxins. This actually applies into, maybe there's a kind of overlap between two of the 6 pillars there.
Yeah.
With toxic exposures and detoxification,
right,
and gut health, because if these gut health are producing some toxins which our liver has to absorb, process, and eliminate, so treating some of those toxic loads, seeing signs of liver stress, and treating it appropriately has been huge for a lot of patients. I was really both surprised but it does make so much sense about how well those work for people, especially if they're having symptoms, if they're having gastrointestinal pain or bloating or cramping or something, sometimes they don't feel it though.
Yeah.
They may not be feeling it.
I find a lot of times we have that, interview checklist, and they fill all that stuff beforehand and then I sit down. I find a lot of people, like, until I kind of meet them and dig in them, not dig, but, just, ask a little bit more detailed questions. A lot of people have digestive stuff that they don't report. I mean, some down to is like, I'm normal gut, normal everything.
Well, you only know yourself generally.
Yeah.
In the bathroom, people,
But they think like going to the bathroom every 3 days is normal because it's normal for them. Or like, I bloat, very commonly, but it goes away, so I'm okay. Or, doc, I got some heartburn, but it's not that big of a deal. And I take some Tums or once in a while. But those are all functional signs of you're on the road to a digestive, bigger problem and disease.
Oh, how many patients come in, new patients, pumped with omeprazole?
No, I mean, it's probably 70% of them.
It's given out like candy, and it does interfere with gut microbiome.
Yep.
There's long-term associations with cardiovascular,
arrhythmias,
and even kidney stuff.
Arrhythmias, though, because there's a study on the magnesium depletion, and you can get an
no
arrhythmia
acid. You're not going to absorb things appropriately. You're missing out on some micronutrients, minerals, vitamins that you would otherwise be absorbing. Yeah, you're missing out. And so getting to the root cause of those issues. Does the person have SIBO or are they exposing themselves to certain foods they're sensitive to? Yeah. Are they, have they been exposed to other, heavy metals or? Yeah. Oh, heavy metals. The same woman?
I love heavy metal. By the way, I just saw a heavy metal band last night. Yeah, took care of these guys. And by the way, I won't say the name because it's going to kind of look bad. But anyway, it was very entertaining. These guys have been around 25 years, 54 years old, still doing it, sober. I love that when these guys get clean and sober and they're still doing it.
Absolutely.
In shape, fit. I love it. When I see guys like that, I love it. Anyway, I'm on a tangent, but I love heavy metal. But go to it.
Hey, rock on, brother.
So but heavy metals, you're saying.
So that same patient, the 95-year-old, her father was a film editor in the 20s for one of the big movie studios. And at that time they were doing, he was cutting and taping the film and all that, and they used mercury in that processing somewhere. Yeah. He had some occupational exposure to mercury. He developed the Mad Hatter's type thing. He had all sorts of, it ended up getting him, Yeah. And so just fascinating that exposures have changed. We're not exposed to mercury like we were as much. I mean, it still exists in our environment, obviously.
For sure, yeah.
And we see people with mercury toxicity still. Just sort of interesting to see what in the next 100 years are we going to look back and be like.
Well, this is a whole separate topic, and I firmly believe, and there's data out there to support this, but when people, our cancer rates are going up, and we know many heavy metals have carcinogen ability, and then you add in immune suppression from COVID and from COVID vaccines and from many other things. But it's like we're getting, as a species, weaker, and our toxic burden is going up and exposure is going up. And I don't think that's coincidental that under the age of 50, we're triple now data on cancer rates than we were pre-COVID 3-4 years ago. So it's crazy, and I do believe toxic burden is a big part of it.
I mean, you can look up the map, the distribution, the heat map of cancer rates, per 100,000 United States. Look at the different states that are, more dense cancer burden. Then you can look at another map of the pesticide, herbicide use, and they almost overlap completely.
Yeah. It's fascinating. Yeah. It's fascinating. But also,
it's not, no causation there. It's association, obviously.
But it's you can't ignore.
There's some signal.
Yeah, you can't ignore for sure. So good. So hey, let's shift a bit, because you have an expertise a bit and a lot of experience in this, and I know you love it. Is the cardiovascular, metabolic health stuff, and you came from another practice that you were doing a little bit more deeper dive in that, and obviously we do this also at Longevity Health Institute. So, can you tell me and give me a little bit of insight into, some of your great stories with some of your cardiovascular patients and your approaches and results, and just, enlighten us on that a bit?
For sure. Yeah.
Well, maybe first too is what is the approach that's different?
Okay, cool. So cardiovascular disease is super common as well. Most people develop some plaque burden. Plaque, right, that's in the arteries. This is, by definition, cardiovascular disease when plaque forms inside the arteries. And we all may develop some degree of plaque, but we also may not. So that's one thing to consider. People start to develop plaque actually very early on. As early as 9, 10 years old, there's evidence of the first fatty streaks forming in people's arteries. So that's one. Two, once a person develops plaque, a lot of people think it's stuck in there. It's reversible. So plaque is both preventable and reversible. Super important for everyone to take home is that if you do have plaque, it can be reversed. So question is, how do we approach it? How do we look for it? Conventional medicine isn't really looking actively for plaque. Let's say someone has chest pain. We know they have plaque. If they have chest pain upon exertion, they probably should see a cardiologist. But most patients come and tell me, oh yeah, I saw a cardiologist. I'm good. I did a stress test. I passed my stress test. I'm all good. Well, yeah. Stress test is it's good at detecting severe disease. Right. And that's...
Well, the studies in 5 years, 15% have a heart attack within 5 years when you pass a stress test.
Because to pass a stress test, you can't have a significant blockage greater than 70%. Right. What about 69%? Right. What about 65%? You'll pass.
And the test itself, the treadmill test, and this, but for our audience, I have patients that will go, oh, doc, I don't need and I know you're going to get into this, a calcium score or a cardio. I had a stress test a couple of years ago and, and I go, and I always say, well, how many minutes did you go? And they're like, oh, it was easy. I went like 13 minutes, 12 minutes or whatever. And I'm like, and this person I know through interview and getting to know, they work out all the time. They're fit, and they may have high cholesterol. Maybe they've got some previous heart disease or whatever, but I'm like, that's not adequate. They cut you off at 85% your predicted maximum heart rate. That's nothing to that person. So you're not really even stressing them. They're just using a statistical, number to just stop it. And they're not really giving them evidence of really true cardiovascular disease. So go ahead.
So VO2 max is a measure of how well your body utilizes oxygen and delivers it to the tissues. Very strong predictor of longevity and huge, super important. If you have really good, if you're athletic and your heart is strong and your vasculature is good, you could still have plaque and not even know it. And
we see it.
And frankly, unfortunately, the most common way people find out if they have plaque is sudden cardiac death, which is not funny. It's scary. And a lot of, especially men and women both, may be at risk. I mean, not to scare people, but like it's a thing that happens, right?
You only know what you know.
Everyone knows somebody. Right. And so how do we identify that is different. Traditionally, what's the screening method? It's like a lipid panel. Yeah. Standard lipid panel, which isn't useless, but almost. Obviously there's some good values in there. You would check your triglycerides. It's good to know about where your cholesterol is, but this idea of good and bad cholesterol, which is the common kind of way most physicians are looking to identify cardiovascular risk, is not the best way. Right. Half of people that have a heart attack have normal cholesterol. I had another patient today. He's 63. He's had 5 stents. Yeah. He went vegan. Okay. He still had another stent. He's on cholesterol medicine. He's doing all the things. Right. That traditional medicine tells him he should. But
that approach, stents beget stents.
Yeah.
If you're not doing anything else.
It didn't help him.
Yeah.
It didn't help him.
It saves his life. It would discount it.
Oh, for sure.
But it's literally kicking the can down the road because he was having more stents to eventually bypass.
Yeah. Because he was having chest pain. Well, actually he had pain in his jaw. He was having, but he was having angina. Yeah. And so it's which test that we're doing, I think, which is different. Like, for instance, Lp(a). This guy has a family history of a cardiovascular disease. Yeah. And I said, do you know your Lp(a) status? Because this is a test that I get every new patient pretty much, which is a type of cholesterol people make that has a tail on it. So I'll get into the weeds a little bit here. So cholesterol, it's measured in your traditional cholesterol panel, is actually the concentration of cholesterol that's being carried around in these little dump trucks called ApoB. Okay.
I like that.
ApoB is the dump truck. Its cargo is cholesterol.
Right.
So the concentration of cholesterol in there is what you measure in your, you want your LDL less than 100. Well, his LDL was normal, was low. He's on a high dose of statin. But his LP(a) was really high, and his doctor said an LP(a) is kind of like an LDL, but it's more atherogenic, meaning more likely to get stuck in the arteries.
Yep.
Why does it get stuck? From inflammation. So it's really inflammation is what's driving heart disease.
Right.
It isn't cholesterol. It's inflammation. His cholesterol is low, yet he has some kind of inflammatory burden. Plus, he has this genetic marker called LP(a), which wasn't being addressed. So this is something I talked to him about. Well, we have to address this. He said, well, there's nothing out. I said, well, there are things we can do. So looking at the right inflammatory markers is important. Artery inflammatory markers. Quantifying your plaque burden. Like you mentioned, the calcium score.
Yeah, calcium score, CTAs, clearly AI technology and that.
Yeah, clearly is super interesting.
Yeah.
That's been a kind of an innovative therapy that we've been using. That it's beautiful images that you can see of the heart.
Yeah, if you're like a techno geek and like all the picturesque stuff, which that's not me, but when I see it, I am kind of impressed. The 3D models, and you can actually see your internal vessel in that. It's impressive.
It's a CTA on steroids, basically. So, it shows with like fine detail, the microvasculature, what is quantifying the plaque burden?
The burden, yeah. What I like too is you can see, so cardiac calcium score, you see just a calcium, which is a risk factor, but that's hard to change. You can manipulate a little bit, but it's not going to change much. That's not why we get, for the audience, heart attacks. It's the soft plaque.
Correct.
Okay, so it's what you can't see. It's just that we know when you have a high calcium score, that burden, the likelihood of soft plaque and risk go up.
Yeah, calcium score is high. It represents historic plaque burden.
Yeah.
Because it takes years for a plaque to go. Plaque starts as soft.
Right.
When it's inflamed, white blood cells, who make the inflammation, our immune system, enter into the artery wall to do repair. They end up, eating up things that are causing inflammation. The cholesterol is there. The cholesterol gets inflamed. They eat the cholesterol. They throw it into the plaque. Now the plaque is soft, and they die inside the artery wall, the white blood cells. Now this creates a necrotic core, or a soft plaque, a plaque that could rupture. Right. So a plaque rupture is really what we want to avoid. But a plaque has one of three options, really. Your body can get rid of it. So if we bring inflammation down, which is what we're doing,
with every patient,
the plaque heals itself. The body knows what to do.
Right.
It's an intelligent, innate healing capacity in our DNA. The instructions are in there to fix this thing. Plaque can be removed. 2, the plaque ruptures. That'd be dangerous. We don't want that to happen.
That's the worst outcome, right?
That's high inflammatory states. 3, the plaque over time could calcify, which sort of cements it over. The plaque is safe. It ain't going nowhere.
Right.
It's calcified. And on a CT scan, calcium, it looks like bone. So it lights up, and we can measure it and see if there's any calcified plaque. So calcified plaque is healed, but it is a good baseline to see where a person is starting. Yeah, see how aggressive we should be.
Yeah. Well, and I'd personally love the test. I order it on every man, if they haven't had it done before, 50 and over. The reason I say is because everybody walks in here into our practice, gets better. So they get more energy. They're going to work out more. They're going to feel better. So they're going to be, going to do things, sports, hobbies, etc. You're not dropping dead on my watch. I literally say that. I'm like, hey, I got a good track record. I'm not going to have you feel great and then boom, have an event. And so I order that, and women too, but usually it's a little bit older and I'm a little bit more conservative. But I want to go back to something, because you said, and it made me think of something about tying this together, because I don't think for our audience, they really will see this. And this is where the 6-point model is so key. Like, it's so key. When you were talking about this, it made me think of many patients I've seen. One really sticks out in mind, but the gut health and how that can influence the inflammation that then influences the cardiovascular health. What does everybody take when you have a bad gut? Tums, Rolaids, what are those? Calcium. Typically, who's this person, right? 50, 55, maybe older even, okay? If they're a woman especially, they have more chance of high intravascular calcium from osteoporosis, losing calcium from their bone. So they have already high calcium in their vasculature. They're taking a calcium buffer for their digestive health that is just a Band-Aid to stop that. They're hypercalcemic, especially if they have low vitamin D,
right?
Okay, and low vitamin K, etc.
Yeah.
They're inflamed because of a bad gut, besides maybe other things, overweight or whatever, you name it. And it's like a ticking time bomb. I've had so many patients when I get a CT calcium score or something that have had really, I don't mean like 20 years of a bad gut. So maybe omeprazole, but also the Rolaids and the Tums and all these things, and like chewing them, like they don't think it's any big deal because to them, it helps their gut. They're better.
It literally tastes like candy. I mean,
yeah. And there's a reason for that. They want it to so you're okay with it and take more. And they're hypercalcifying their vasculature.
Well, there is some evidence for that.
There's huge evidence.
You take a lot of calcium in an inflammatory state.
Yeah.
Some of that will probably end up in the artery.
Right.
Doesn't mean not necessarily.
Yeah.
But that's possible.
It doesn't improve it, that's for sure. It could make it worse, and depending on the scenario. But I've seen that in a few patients, and a few that really stick out in mind that were just drastic. Like their calcium scores were so high, they had so much, cardiovascular, burden that it was just. They obviously went on to stents and everything like that. But that just really sticks out of my mind.
Well, everything enters through right here.
Right. So that's where the gut comes in.
So yeah, everything that comes into your body comes in through your mouth, or your nose, or you're breathing it in. But the foods, the GI tract, that hollow tube, okay, is actually outside of your body. Mm-hmm. Whatever's inside your GI tract is outside your body.
Yeah.
Until it gets absorbed.
Yeah.
But that is our biggest exposure to the environment.
Right.
So all of our defenses, all of our immune system, our gastric-associated lymphatic tissue, our lymph nodes, our digestive tract is full of our immune system. All those white blood cells, by the way, are the guys who do the inflammation.
Right.
But we need them to fight infection and to prevent these bacteria and yeast and stuff when they do get through leaky gut or whichever way they get through, to get rid of them.
Yeah.
But creates most people's inflammation starts in the gut.
Yeah, yeah. Well, that's one thing we solve, and we see their CRPs, their high sensitive CRPs go down, which immediately reduces their risk of going back to cardiovascular health, no matter what's going on. So that's why you have to look at the whole picture, and why I'm proud of how we institute this, approach in our practice,
Yeah, and patients feel, I think, it's sort of inspiring to them to know that they can change this. Mm-hmm. That they're not stuck with the plaque, they're not stuck with this burden, and they can improve themselves and extend their well-being and their lifespan. So it's sort of fun to turn that corner and kind of enlighten people in that way and show them that their body knows what to do. Yeah. You just gotta give them the right things.
Give them a nudge. Yeah. So I'm going to enlighten you on something, and the reason is because you don't know this, that I'm doing this in the practice, but it's kind of like on the DL. Okay. So it's all good stuff, but we're going to see what happens, and it's about Lp(a). So niacin can lower Lp(a) a little bit. I mean,
in some people it works pretty good, actually.
Yeah. So I've read some studies. Have I seen it really much? No. The reason is because most people can't tolerate niacin, or they are very difficult to, even though we can try some routes with applesauce and aspirin, and they can get a little bit of tolerance to it. So then that rash or hive or flush isn't so reaction. Bad. But I have a lot of patients that, like, the minute you say it, oh, I've done it. No, I'm not doing that again, because how severe it is,
Yeah.
And what's that?
It can be. I've tried niacin.
I did it once just to see what it was like.
I was driving. I said, man, it's hot as hell. I was like, what is, like, the sun is beating down on me. My ears felt flush.
Yeah. I felt prickly. It's weird to me.
But there was no sun. I was like, oh.
Yeah.
I was like, oh, yeah, I took the niacin.
Yeah. So, but what I'm doing is,
I think I know what you're doing.
Yeah, you know what I'm doing.
I think I have a.
What do you think I'm doing? We haven't talked about this, have we?
You're probably doing NAD.
Yes. Love NAD.
And NAD is pretty powerful.
Yeah,
it's impressive.
NAD. It's impressive.
Yeah.
Yeah, it got me here. No, but seriously, so NAD is obviously downstream, from niacin. It's a niacin essentially derivative. I don't know clinically if I'm going to see that happen, but I'm watching a handful of people
though.
because they're going to get the benefits of all the genomic protection. They're going to telomeres and, help senescence and help their circadian rhythm, help their energy, help all these longevity benefits you can hear about and read about. And we can do a whole, and we will, podcast on NAD. Mm-hmm. How many patients we have on NAD now because we can do it injectable, not just IV drips and precursor NMN. NAD is amazing, amazing. It's actually, I got to say this, hands down, one of the top 3 things in 25 years that I've used that is like so impressive now that I have it in our arsenal to use more of.
Yeah, absolutely. I've tried it myself.
Yeah. It's like crack.
Well,
you want some more,
I don't know,
you?
but I mean,
well, I don't know, but I'm just assuming. Well, on the streets, what they say.
But I did get a bottle, and I have given it to myself, intramuscularly.
Yeah.
And I did it when I was kind of coming off a cold,
mm-hmm.
and man, it brought me back. I mean, it gives you energy,
mm-hmm.
and it's palpable that you can feel.
Oh, yeah.
Most things you take supplements, we know they're helping, but oftentimes you don't really feel anything.
Mm-hmm.
This is
or
different.
it's so slow.
It's
it
slow.
Might take a month to feel.
Yeah, it's not a short-term thing. This you can feel right away.
Yeah.
Within 5 minutes, you can feel it.
Yeah. What I noticed, and this is not, up in the, high end of why we use it. I used it obviously for the longevity and health benefits and that. But what I noticed, which was, and I looked into it, and there's some reports of this, but is cognitive focus. I call it less squirrels, just more focused, more dialed in, more attentive to what I'm doing, completing more tasks, less, like you said, less brain fog, that kind of thing. But I mean, it's so beneficial. I mean, I could go on and on about benefits, but what I'm doing though in the practice, just with a handful of people and watching them, is what their LP-LA does. Because normally what I do is just make sure on their baby aspirin, have them on a high dose vitamin C. Most of these people end up on a low dose statin because of their risks and that, which again, we can dig into why and why not and who's right for, but I'm curious. I think it's going to have some benefits.
Yeah, I don't think there's been studies yet. That'll be really interesting to see. I'm sure someone's doing it.
Because people love NAD and they don't like niacin.
Right.
So let's give them NAD and they get all the benefits,
Yeah.
Yeah.
Because, niacin's been used forever as a lipid lowering agent,
Mm-hmm.
and it does work on that front. And it seems like the flush reaction, though, may be part of it. We're not really quite understand why it helps some people and why it doesn't help other people.
Mm-hmm.
So it's kind of interesting.
Yeah.
There are things coming down the pike that will knock LP-LA out. So we'll have to see if those are safe. We have to kind of vet these big pharma because we got to leave it for a few years, see if it's even worth using.
It looks impressive in the studies I've read so far, but you got to go like, okay, where is this going to leave us? So in 7 years, what kind of side effects in that are there going to be? And I've read some of that too, which would be great though, because that's the, it's hitting it at the genomic level. So I think that, is interesting, So let me go into one other thing.
Let's go.
I mean, we could talk about cardiovascular health like forever. So
if we're talking cardiovascular, we have to talk exercise.
Yeah, absolutely.
Because of the benefits of exercise.
Mm-hmm.
And sauna is a surrogate for exercise,
Mm-hmm.
especially for people that can't exercise. Maybe a really good option. Mm-hmm. But the body thinks you're exercising.
Yeah,
the heart rate's up.
Yep.
Body temperature is increasing. Blood vessels are dilating. All things that increase blood flow and increase vascular exercise.
Yeah.
So, and the data is impressive with sauna.
Mm-hmm. Yeah.
It's more impressive than statin.
Mm-hmm.
And it's you get a 2 to 3 times a week sauna. 20%, 22% risk reduction of sudden cardiac death. This is in a big study out of Finland, where they took 20,000 Finnish guys. Just observed how often they saunaed. Those who saunaed more than that, 4 to 7 times per week, had a 60% reduction in sudden cardiac death, which is huge.
Yeah, immense.
The overall risk reduction. And then same with dementia too. There's anti-dementia benefits, similar pattern.
Yeah.
So
I think that it's huge too, which, it's talked about, but I don't know how much value is put into it. You're not going to detox a heavy metal likely because it's not going to go through your pores, obviously.
Some of them, cadmium, aluminum.
Some can.
You can get rid of some of them better than others.
Yeah. But
robust.
all the stuff that is like, call it the low-lying fruit that we're so exposed to all the time. All the pesticides, all the
microplastics, endocrine disruptors.
You name it.
Yeah.
You got to sweat, man. I have so many people that don't sweat. I personally, I think I've told you this before, and I heat up my workout room to over 100 degrees.
Love that.
And I sauna. I don't have a sauna. Need to get one. My wife's on me every day. I got a cold plunge, and she's like, I don't want to get in that. Are you crazy? I'm not getting in that. And she's, because it's like miserable, but it's addictive. It's great for you. It's addictive. But I got to get a sauna just to make sure I stay married. But I sauna every day by the workout thing. But you got to sweat. If there's something out there for everybody to understand is, because a lot of people lift weights and, like, oh yeah, I think you said this, but it mimics it. And if you're older and it's hard to get your heart rate up and sweat like that or whatever, I think that's where it really gets in there.
Well, it gets things moving. That lymph, those lymph nodes, those are where your white blood cells go to train.
Yeah.
You need to move the lymph. Obviously, exercise helps your body to move that lymph around, but sweating is absolutely linked and is a way we can detoxify. Absolutely.
Yeah. Yeah. And I do have to say this. There's some shit come on me. I'm coming out of my pores. And you know why I know this? Because my Frenchie, when I get off my bike or whatever, and I'm wiping off whatever, he comes right over and starts licking me all over the place.
Oh, that's salty.
And I'm like, I know I'm salty, but there's some other stuff in there that he's digging. So now I got to detox my Frenchie. I got to figure out how I'm going to get him to detox.
Don't put your dog in the sauna.
Yeah, no.
PSA.
No, yeah.
They can't sweat like we can.
Yeah, right? yeah. Let's not go there. I don't want to get. Yeah. So, but no, good stuff, man. Great. So let me just go into one other thing because it's so huge, and we will do a whole podcast on sauna. And you are so knowledgeable about it, and you do love it. It's a passion for yours. I love your passion with that, and it's so awesome. So it's so great for you, and it is fun to do, and it feels good too, man. But we will do that. But I want to read another quote to you, just because there's more strategies and tools and things that we do in our 6-point model, but also in coaching, like lifestyle things that we do in the practice. And I love this quote, but I just wondered what you thought of it. Okay. When you're going through hell, keep going. What does that kind of resonate with you? And what might it mean? Or any personal, insights into you yourself, like when you're in a hell state, whatever that is.
Yeah.
Personally, professionally, physically, health-wise, anything, and then, the keep going.
The keep going part's important.
Yeah.
That's maybe the most important. I mean, obviously, we all go through difficult challenges.
Yeah.
Things that kind of strike at our core, make us challenge, our whole thought, our whole being, our whole beliefs. And if we don't keep going, you get sick. That slows you. That will slow you down. You can get stuck. Your mind can get stuck. So yeah, I mean, I've been through some things that have rocked my world in that way, and it's interesting. It's kind of this quote sort of shakes me up a little.
Does it? Oh, I like that.
In a way, yeah.
Well, let me tell you mine, and I don't mind sharing it because
I have some things to share, but yeah.
But the reason is this: I love this quote. I love these quotes, and I bring these up in our podcast all the time. Because it like draws something out of me, and I'm a firm believer of, man, what doesn't kill you makes you stronger, and how you always just have to keep going. And believe me, I say this vulnerably a little bit, is like COVID and COVID times. And there's many things in my life that were big struggles and stuff, emotionally, physically, psychologically, you name it. But this one is fairly recent. That's why it's fresh in my mind. But dealing with hundreds of concierge patients in crisis, like in COVID freak out moment, when we didn't know what was going on. And people originally were very, very sick. Okay. And especially my older patients. And if you had any other, comorbidities of that. So my phone was going off. I mean, I was sleeping with this thing, and
I remember that.
I had a couple patients bringing oxygen to their house, and then I get it, kicks my butt. My wife gets it, kicks her butt. I got to take her to the hospital on that, And of course we did many things, ivermectin and immune boosting things and all these things that, you know, nothing ever got severe pneumonias and anything near, like, thank God, you know, intubation and, you know, anything like that. And as well as patients, you know, patients of ours with all our practitioners and, you know, thousands of patients, they all did very well, but it kicked my butt. And I was really dark. It was really dark at times. I'd go to bed at night and like, when's this going to end? And how is it going to get better? And, you know, I literally was like dark. Like my wife was even like, you need a break. You need to get away. You need to like, but I couldn't, you know, I couldn't in that. And it lasted a good year and a half. And the one thing that I go back to with this was, because, you know, we had some, and I didn't isolate. I mean, if there was a restaurant open on Friday, Saturday, I take my wife to in the tent that's got the heater in it, you know, and I'm a rule breaker in a lot of ways. So I'm like, you know, but I respected obviously everybody's thought process through this and health through it, et cetera. But my point is that I was like, I still continued living, but there was like an isolation. I'm so social and I'm so big into being how community and social. And I guess that's really important to me. And that was kind of taken down a bit. Yeah. I can't forget this part. When we couldn't go to up north, and my brother has a cabin up north, and I was like, we can't go. I'm like, what do you mean we can't get out of town? Like, this is insane. Just to get a break, to get, you know, some freedom. And that, so, but one of the things that really did eventually get me through it is I kept telling myself, well, just keep going, just keep working, keep doing your thing, keep working out, keep getting your blood flowing. I mean, no joke, keep sweating, keep taking your vitamins, and when you got through it, man, I think it empowered me. I look back at it made me stronger. You know what I mean? But I love that quote because a lot of people get stuck in hell, and I could have easily or started to, you know, but I did just, you know, mental fortitude. Fortunately, I have a lot of support around me, like my wife and that was like encouraging me and coaching me to like, you know, hey, it's going to get better and you're doing all the right stuff and all that stuff. But it you know, that. Yeah,
you're right. It takes, some people didn't make it out. You know, I remember.
Well, tons of docs retired.
Well, that was a crazy time. I was in the hospital when COVID hit.
Okay.
They pulled me back in. I was on electives. They pulled back. I was working, you know, 80 hours. Just the people were sick. There was no one to work.
Yeah.
So all my patients died. Usually you have you're in a medical service in the floors. Mm-hmm. You have 20 patients on your list. You know, maybe, you know, if someone's sick, you know, every patient died pretty much. It was crazy. Jeez. It was like literally like a hellscape. I mean, it was like a war zone.
Yeah. Well, you know, and I take care of doctors, you know, as patients, you know, we have in our practice. And I mean, they were talking about me dark. They were dark and they were like, this is like so depressing. And so everybody was miserable.
Yeah. And you know, we just read a book in our, we have a book club for the practitioners. It's called Humankind. Mm-hmm. Really inspiring book. It talks about how people are generally good and how people do come together. Mm-hmm. And it does sort of take other people. We're social animals. We have to stick together during difficult times, and to get through. And people help each other. They really do. People really open up their arms. I mean, obviously that was an incredibly isolating time.
And that's what I think for a lot of people. Tough for,
like I literally lost my best friend in part due to COVID because he took his own life. He didn't get out. He got stuck.
Yeah.
And he was incredibly isolated. I think he also had some COVID induced, you know, mental illness.
Yeah.
And which has been documented.
Well, there's studies on it, on lowering serotonin.
So I think this is maybe my most challenging events, all stemming from, I guess from COVID. I mean, it was a pretty crazy time to look back and think that we're sort of out of that.
Yeah.
And, you know, it's a much different disease now, but getting through the support of people, I think maybe is the most important thing to take away from, to keep going, to support each other. You know, I think these are the things, and be sure to connect with your people.
Yeah.
You know, and look out for people who may be stuck because, I'm very positive. I will always keep going, you know. But we gotta reach out to each other and help each other.
It's definitely a mindset. Mm-hmm. Well, thank you for that. And that does. So, you know, one last thing is I just want to bring this up because, we offer this in the practice. We do this. A big part of the practice, probably at least 50% of our practice is a concierge practice, call it a direct pay model, what have you. And you came from a practice where you were 100% concierge.
Yeah.
And personally, I hate that term, but a lot of people, if they Google it, they can read about it and understand it and all that, because it really doesn't, to me, really tell the story of what we're really delivering.
Sure.
We're delivering good personalized medicine. That's
kind of a direct model.
But it's personalized,
Yeah.
and we're giving them what they deserve. What really medicine should be and was back in the 40s and 50s. And forget the doctor, Dr. Wolby something. he would come to your house and, house calls, and he knew you and he knew everything, and you call his house if you had, I know now, they call our cell phone or text us or what have you. But tell me why you got into that and how you see it work and what the benefits are.
Mm-hmm. Yeah, no. So I saw friends and colleagues who were basically burnt out in the conventional system. And I was like, hey, I love medicine. I want to do this, but I don't want to do that.
Yeah.
I have friends still who I talk to. They're seeing 40 patients a day, literally 40 people.
Impossible.
In primary care.
Impossible. How do you see 40, 50 people a day?
They hardly see them. They see them for a couple minutes and on to the next room. It's like a revolving door kind of model.
Mm-hmm.
And I was like, man, I really don't want to do this anymore. I was trying to think of what else I could do. How else could I use my education? And then I learned about, direct primary care or this direct model, concierge medicine. And I said, yeah, I think this sounds better. Mm-hmm. And what it really enables, I think the most valuable part of this type of medicine is that you have time.
Yeah.
You need time.
Which is happiness.
That's true.
Right?
That's right.
Well, things come full circle. I didn't mean for that to happen, but
no,
innately it can.
It really is. I mean, it takes time to learn who a person is, to get to the mind, body, spirit of things.
For sure.
You need to understand them and who they are, learn who they are.
Mm-hmm.
What are they like? You connect with a person on a much deeper level when you have more time with them.
Yeah.
It's pretty simple. And then the convenience factor, when I can just call my patient, or they can just call me and ask me a question or talk to me or say, hey, I need this or that, or, they have questions about something simple even. Mm-hmm. It's so much more efficient.
Yeah.
And higher quality care.
Yeah.
Than waiting for, going through the traditional channels. They call the office, the phone rings, they talk to somebody, they leave a message.
Maybe they talk to somebody. I mean, not our practice, but I'm just saying, but I have a story just recently where somebody is going to a practice in Florida for the next few months, and they normally are in Michigan, and they're trying something down there. It's a long story, but they are so frustrated. They're one of my concierge patients, but because obviously they're just dealing with that practice and what's happening down there. And I'm like, well, that's kind of, that's a normal medical, even though they're delivering something good to you that you might need or want. It's a broken system.
Well, things are lost in translation.
Yeah.
You end up saying the same thing again and again and again to 4 different people to get the same message across, and it's inefficient. And as a patient too, I've experienced it too. Just being on the other side, it's just inefficient, and it's much more fun mm-hmm. as a physician to get to know a person and connect with them on that level. And so I think the biggest benefit is enabling time.
Yeah. Well, I thank you. I that's a great insight into that. I was shocked today, and this is what happens, but this is what I love is when part of our, one of our taglines is making a generational impact on you and yours. And today, 2 of my new patients today, it's a weird day for me. I had all these new patients, which usually I don't see that many new patients because I don't really have space for them. But I mean, and they were adults, but they were referred from their parents that are my patient. Mm-hmm. They were young adults, fairly healthy. I mean, nothing major, but they were referred because of our model and because of results and all that. But they were 100% in our, direct pay model and that in our concierge model. And the reason was because they'd seen a few practices, a few, docs, not great results, giving them this. I call it the, hey, you're fine. You don't have a disease. Here's your blessing. Here's your 3 to 5 minutes out the door. Okay. And they're like, wait, I still feel like shit. And you just told me that my testosterone's okay. It looks really bad. Why is my, thyroid not optimal? Vitamin D is like 20 and you just said, yeah, take some vitamin D. You didn't even give. So they don't get a great direction and they're like very disappointed and disenchanted. And like, so it's just our system is so broken. And what I loved, my point of this story is the parents directed them to like, you got to go to somebody, because they're adults. They live on their own. One of them's married and has kids, but you got to get real care, get personalized care. And, and the thing that is so important, and I call it doubling in medicine, compounding, if you will, in finance, you can, think of that, is that when you do something so basic and simple, but to the core of what the real problem is, results multiply. So when they're young, they have I call it the runway. I told them this. I said, I love seeing you guys when you're in your like mid-20s because we have a long life runway and we can start making some big difference. And the impact of what we change and help will help their trajectory of life forever. I just, that's exciting to me because when I'm long gone and dust and whatever, but what my point is that they'll be better.
Yeah.
And I love that.
Yeah.
Yeah.
Yeah, I think it's important. I do think my patients who are in that concierge model are healthier in general because they're getting more continuity of care.
Yeah.
Otherwise care kind of stops at the door. They had to wait however long, a month or, a few weeks to come back in. Whereas the conversation can continue.
Yeah.
We're not closing the door and reopening it. The door is open.
Yeah. 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 Love it. Love it. Well, we'll end up having a podcast now just on concierge medicine with sauna and maybe in a sauna.
Yeah, that'd be fun.
That'd be fun. You want a sauna what's funny is it like no matter where.
It's kind of like a little echo chamber.
Do you have it in the parking lot here?
I should have brought it.
I know. You see,
it's mobile. I could have.
I know. You built it on a trailer, you and your dad, and it's, yeah.
Yeah, it was.
I think this is a side business you need to get into.
We thought about it for sure. I mean, it was fun to do. I would encourage everyone to pick up a project like that.
Yeah.
I mean, it was good for me and my dad to kind of bond over.
That's
it was
awesome,
like he helped me to build it.
Yeah.
Yeah, man. That's on the list.
We'll do it.
I'll make another one.
We'll do it. Yeah. Awesome. Well, hey, Dr. Ryan, Dr. Abboud, thank you so much for being part of the Deep Six and let me, interview you and go through this. And again, not just a pleasure, but at a respect, love, and appreciation level I have for you and the practice and all our providers and patients, I'm thanking you, for your service to them because I know they're so happy and doing so well and you're making such an impact in their life and their family and their quality. And
not a lot of bosses. You don't hear this from a lot of bosses.
Yeah. Well, it's,
a real boss.
Yeah. A lot of love.
A lot of love. It's all love.
I don't think of myself as a boss. So whatever. We'll get to that off air. But this is Dr. Lorenz from the Deep Six, and I appreciate you visiting with us and us sharing this knowledge. Dr. Abboud can be seen at our practice at Longevity Health Institute, so just look us up and join us again here on the Deep Six. This is Dr. Lorenz. Be well.